This is our ER room design project. My name is Annie.
I'm Ishan.
I'm Samira.
I'm Jade.
I'm Allie.
I'm Sierra.
We are incredibly excited to give you a virtual tour of our emergency room. Located on the corner of Windmark Drive and Elk Grove Boulevard, our facility takes into account the community's demographics to provide tailored patient care to all Elk Grove residents. Right now, we are standing at the main entrance of the emergency department. As we enter the emergency room, there will be a staff member awaiting patient arrival who will direct patients as needed. Most often, patients will start with a registration desk. Here, they will provide basic information such as their name, reason for visiting, and any medical history or insurance details. To accommodate the diverse demographic of Elk Grove, we have bilingual staff members working the registration desk, capable of communicating in English, Spanish, Chinese, and Vietnamese. After completing registration, patients will be placed in a queue to be immediately assessed and triaged. A unique addition to our ER is an integrated registration and triage process which directly connects our triage team with our registration staff in order to improve communication and effectively assess patients by reducing handoffs.
Once seated in the triage room, patients' vitals and current physical conditions can be assessed. They will then be prioritized depending on how urgently they require care. The triage room is equipped with 6 chairs including privacy curtains that separate each station. Depending on room availability and triage status, patients will either be transferred to an exam room immediately or directed to a waiting room where they will be awaited their turn. Outside the triage room, there is a hallway that leads to other rooms and departments within the emergency room. This hallway is designed for employee and staff usage only. By utilizing a hallway for only staff members, we hope to eliminate traffic and congestion in hallways, making it easier for patients to receive timely care. Directly besides the triage room, it is our fast track unit. This unit is equipped with 8 beds and is designed for patients with less severe conditions such as a minor injury or illness. Its convenient location allows lower acuity patients to receive rapid and effective treatment without congesting the main ER.
As you walk further down the hallway, you will arrive in our radiology department. This department is centrally placed between our trauma unit, critical care unit, fast track unit, and OR rooms. The strategic position ensures rapid accessibility to diagnostic services, especially for higher acuity patients. The X-ray, MRI, and CAT scan rooms are all located in the same department, allowing patients who need multiple scans to receive imaging without unnecessary transport. In the far corner of our building, we have 2 operating rooms, located down the hall from our EMS entrance and trauma unit. Each operating room has a sterilization area where staff are required to complete a sanitization process before entering. Across the hallway from our operating rooms is one of the nurses' stations, which overlooks the critical care and trauma unit, allowing for more visibility and accessibility to our patients in critical condition. Alongside this wall, we have our critical care unit designated for patients who require intensive monitoring and advanced medical treatment. Glass walls are used to optimize patient visibility and curtains are placed between beds to ensure privacy.
Our emergency department has 2 large trauma bays equipped to handle the most urgent cases, from stabilizing patients to preparing them for surgery or other further treatment. Both bays are designated with state-of-the-art equipment, including ventilators to assist with breathing, defibrillators for cardiac emergencies, and advanced monitoring systems to track vital signs like heart rate, blood pressure, and oxygen levels in real time. All resources that allow our medical team to respond quickly to emergent cases spanning gunshot wounds, heart attacks, car accidents, and more. And at the end of the hallway, these double doors lead to the EMS entrance. This is a separate emergency entrance point accessed only by ambulances and emergency vehicles. We can likely assume patients who arrive via ambulance are of the highest acuity, so we place the EMS entrance directly next to the trauma bays, with open doorways and wide floor space to move efficiently. On the right is our quarantine room. Isolated from all the other departments, the quarantine room is for patients who have been admitted with a contagious disease that could potentially spread to other patients and staff. Since patients will be spending an indefinite amount of time, we've provided beds, a bathroom, and supplies within the room. Both the EMS entrance and infectious disease units are located on the opposite side of the ER from the main entrance, to avoid high patient traffic and obstructed access.
Across the hallway is our specialty unit.
The specialty unit is assigned for orthopedic, neuro, and geriatric specialty services. There are 3 beds dedicated to one of each specialty, all of which are separated by curtains. Just a short distance from our centralized nursing station is the pharmacy and lab. The close proximity between the lab and the nursing staff significantly improves the processing and retrieval of lab reports, a major delay in the diagnosis and treatment of patients. An accessible pharmacy also allows nurses to quickly obtain and administer prescribed medications, pain management, or anesthesia without delay. Across the walkway from the pharmacy, you will find the emergency room storage unit. In here, we keep all of our miscellaneous supplies, including cleaning supplies, extra clothes, slippers, and masks for our patients or staff, pillows and blankets for bed, and more. Next to the storage room, there is a staff on-call room. The staff on-call room has bunk beds that our medical team that are working night shifts or on-call duty can rest during breaks. Also located next to our nursing station are our main exam rooms designated for the treatment of lower acuity patients following triage. Our exam rooms have 6 beds, all of which are separated by privacy curtains. Patients can be led to one of these 6 beds directly from the triage room through this door.
As you continue, we have our mental health department. We have a counseling room for both staff and family members in the event of a loved one passing away or for overwhelming stress and anxiety commonly found in an ER. In front of the nursing stations, we also have our 2 psych rooms. These are designated for patients who have been brought in the ER for mental health concerns such as depression, thoughts of suicide, eating disorders, and other sources of harming oneself. Both rooms are placed in a quiet section of the hospital to decrease stress and anxiety and are limited to 1 patient to maximize privacy.
In the center of our emergency department, we have the main nurses station. The nurses station is divided into 4 sections and headed by the physician's table. Each section is a team of nurses responsible for one of 4 zones sectioning the ER. By putting all 4 nursing stations next to each other in the center of the facility, we can maximize communication and collaboration and give them easier access to patients and resources. Across the walkway, we have another restroom that is for both patient and staff usage.
If you walk through the door at the end of this area of the hospital, you will enter the pediatric unit of the emergency room. In order to accommodate the large portion of children and teenagers in the Elk Grove area, we have a department designated to treat patients under the age of 18. We have games and entertainment for the young patients to keep them calm and cooperative in a stressful environment. For patient assessment, there are 5 beds, each of which are separated by walls for privacy of our patients. As you leave the pediatric unit, there is a hallway that features 2 green rooms. We include green rooms within our hospital to try and alleviate patient stress and provide an area in which patients or family can relieve any anxiety they may be feeling. We included a skylight feature to allow in natural sunlight, and we made sure to use plants that were hypoallergenic to try and decrease the risk of any allergic reactions or medical problems.
As you go further down the hallway, there's a cafe and lounge area. The cafe has coffee, drinks, snacks, and food that both patients and staff can enjoy. Across the cafe, there's a sitting area for our guests and staff to enjoy their drinks and food. And as you walk through these doors, you will notice you have returned to the main guest entrance of the hospital.
Thank you for listening to our tour and layout of our emergency room.
And this is our pitch for an ER design, which we created on a digital model. The focus of the project is to address common problems in the typical emergency room, like long wait times, congested hallways, and lack of communication.
Reducing wait times. Monitors will be placed in patient rooms, notifying the EVS team the second a patient has been discharged and immediately updating RT system, which a room is prepared for patients. This establishes a line of communication between triage nurses because the EVS team prevents janitorial staff from intersecting with patients. Our system will include a large digital display that is available to the triage unit and central line nursing station. It displays room availability and it includes estimated wait times for the rooms already in use. Our block automatically assigns patients in the block system, allowing the EVS team to sanitize and prepare rooms in low-activity blocks away from high-activity blocks. Lack of ER and staff communication issues can lead to increased mortality rates. To combat this, our ER would have an internship program for our current medical students. They would need to complete a series of tests and training to be eligible. Their duties would focus on improving communication between patients and staff. Interns will be expected to update patients on wait times, answer questions or concerns regarding patient activity, clarifying procedures, and provide basic services and emotional support to families. This allows the ER staff to focus on assessing and treating patients while still ensuring proper communication and patient satisfaction.
To address one of the most pressing issues regarding patient safety, our ER is equipped with 2 devices that will reduce the common miscommunications between patients and staff. Oftentimes, after a patient has been discharged, they leave the ER feeling anxious, overwhelmed, and unsure about their post-treatment care. Overall, this lack of communication leads to poorer health outcomes, improper medical usage, and high readmission rates, ultimately increasing patient risk and straining hospital resources. To combat this, we have implemented discharge stations equipped with interactive computer kiosks that provide patients with clear, personalized, and in-depth information on post-treatment care. In periods of low patient volume, this interface can be accessed within the treatment room via a portable tablet. In periods of high patient volume, when rooms need to be turned over as quickly as possible, patients can be directed to the electronic computers located near the ER exit. Both options improve optimal wait times for incoming patients and ensure thorough debriefing and post-patient care. Thank you for listening.